And welcome everyone. So obviously, as we're working with substances that have been used for thousands and thousands of years in many different rich traditions, I want to make sure that we do take some time to acknowledge that we are conducting the Zoom here from Victoria, which is the traditional and ancestral and unceded territory of the Songhees, the Esquimalt, and Wuthanich people. I would also just like to acknowledge and take a moment of silence for the over 200 bodies that were found at the former Kamloops Residential School. So everyone would just join in with me for a moment of silence. Thank you.
All right.
So today, yes.
Yeah, just want to introduce myself. I'm Yasmin, and I'm the Director of Training and Operations at TheraPsil. And over to you, Spencer.
Thank you. And my name is Spencer Oxwell. I'm the CEO at TheraPsil, patient rights advocate and lobbyist. And over to Dave Phillips.
Hi, everyone. It's just so great to be with you from Abbotsford, British Columbia. And I've got a beautiful evening unfolding here on the West Coast. Good to see us, folks from across our beautiful nation here today, and really happy to be here, share a little bit of my own personal story, and also just talk about why having experiential knowledge of psilocybin is absolutely foundational to safely and effectively hold space for people therapeutically.
So before we get into Dave's experience, I just wanted to share a little bit of background on Dave. So Dave is a registered clinical counselor in BC. He's also a Section 56 exemption holder and the lead trainer of TheraPsil's beta training program for healthcare practitioners. He's also leading 2 more training cohorts for TheraPsil right now. We're so grateful to have him. One is taking place in Northern Ontario, the other in Toronto, and many more to come in the fall. So stay tuned for that. Dave has been teaching 21 healthcare practitioner skills training related to facilitating psilocybin therapy for patients during a group experiential, and their group experiential retreat is coming up soon, pending that their exemptions come through. Dave was granted a Section 56 exemption for training purposes by our federal health minister, Patty Hajdu, in December 2020, along with 18 other healthcare practitioners. So pretty much this exemption allows Dave and the others who are granted their exemptions to use, transport, and possess psilocybin under the condition where psilocybin is used for the purpose of psilocybin-assisted psychotherapy training in accordance with the TheraPsil's training protocol and curriculum. And as I mentioned, 18 other healthcare practitioner professionals in Canada have those exemptions as well. And Dave is one of 5 who has legally had his experiential session. So over to Dave.
Yeah, so go ahead if you want to talk about this. Yes, go ahead.
Yeah, so what's the learning objective, Dave, of your training program?
Yeah, so as an educator, understood, like, establishing an objective for learning is absolutely imperative. We've got to kind of know the goalposts. What are we going for? And I'm sure most of you can appreciate with the kind of very nuanced history of psychedelics in the West, especially with the fact that it's a Schedule I substance and very, very illegal. So much stigma and misunderstanding is around it. So, as these substances are emerging into the research field and for understanding it, as we began to talk about, hey, how can we now train therapists, which is a new thing. Up to now, it's been largely the domain of the research field, where they've heavy controls and they're working with research subjects. That working therapeutically is a very, very different thing. And so one of the first questions that gets asked is, how essential is it for the practitioner, the therapist, the nurse, the physician, whomever it might be, to actually have their own experiential kind of connection with psilocybin? Is this something you can just know about through a book? So when I began to put the learning objectives together, you can see in bolded here are the words safely and effectively. And for me, that really helps me understand or helps guide this conversation. So is it possible for someone who's never had taken psilocybin themselves to kind of, hold space for someone who's on a journey? Sure, absolutely. And that's not the issue we're addressing ourselves to. What we want to talk about is, can you safely and effectively do it towards therapeutic outcomes? So in our case, we're talking about palliative patients who are, experiencing very, very serious anxiety related to their disease and potential premature death. And so we're with those people. It's just not, regular public. We have to be very, very careful with how we hold space and how we understand in any given moment of the experience what's happening with a person. Well, because this is altered state, it just simply can't be done just from a textbook or from just classroom learning. You actually have to experience, and that's kind of our challenge. Like you said, Yaz, we have our own retreat coming up for our first cohort, and we've got 2 other cohorts, and they've been preparing each other in dyads and very excited about having their own journey, holding space. And yet we've had to say to our cohort, we just have to put you on hold right now, as we don't have exemptions to do it. So, and our opinion is we are not going to go forward with the training without this experiential piece, because in my judgment, we would not be able to safely and effectively hold space without it.
Absolutely. Thank you, Dave. And I've seen firsthand how hands-on your training is, and there's so much learning that's coming out of that. And I know because you have your own Section 56 exemption,
Right.
You've seen firsthand the benefits that
Right.
you have for your own therapy in having that experience. So can you describe in your own experience and how it has best prepared you to facilitate psilocybin therapy for your patients and clients?
Yeah, absolutely. And as I started, I just want to be, really open and vulnerable to you all to say, I'm just going to tell you my experience. And any psilocybin or psychedelic experience is always so unique, and everyone's journey is their own because they have their own intentions and their own work they're doing. But for me, so I'd been working in class and mentoring and understanding psilocybin, like I say, really from a left brain kind of perspective, kind of understanding the history of psychedelics and psychopharmacology and all the cool little bits with that. But I knew I needed to have my own experience. So when I got the exemption, I went toward the experience, and I was really fortunate to have the space held by just a really warm and generous person, and just a really nurturing presence. So I felt really great. And this person had a couple therapy dogs. I remember that. And so they were with us. And so when we got into we do a little bit of a ceremony as we go in, and it was very beautiful, very new for me. Now I should tell you a little something about me. I've never done any psychedelics in my life. When I was in 11th grade, I was working for a local company, and a guy that worked for me was also in 11th grade. He came to work on a Monday morning, and he looked horrible. His face was ashy, and he was also just looked like he'd been through the worst experience. And I said to him, Craig, what's the matter with you? And he said, oh, we did blotter acid on the weekend. Blotter is just LSD. So they dropped him and his friends dropped some LSD. And he said, Dave, for 10 hours, I was trapped in a room with killer insects trying to destroy me. And I freaked out. I thought, if psychedelics can do that, I am never doing psychedelics. I was just a kid at the time. But that's deep in the back of my mind as I went to this experience. And so again, my guide was so great. And he put the headphones on and the shades, which is the protocol for the therapeutic experience. And I settled I was on like a little futon. I settled in. And the first thought that went through my mind is, I don't think I want to do this. I started to get really anxious, and I started feeling quite nervous because I felt like I've already taken the psilocybin. I don't know if I've done the right thing. And all of a sudden I felt some movement, and one of those little dogs had jumped up onto the bed. It kind of came over to me and laid down on my legs and fell asleep. Just this little dog, and its energy was just so beautiful and warm. And I thought to myself, well, if this little dog cares enough about me to kind of attend to my little anxiety, and I just thought about the guy holding space, and I thought he loves me. And my wife was at the library doing some work, and I knew that she was thinking about me and giving me her warm thoughts. And then I just thought how beautiful this medicine, and I have studied it, and I know this is safe. So I said, okay, I'll surrender. And I did. And I don't remember really how the trip started, but I had some experiences during my trip which were just absolutely life-changing. Do you want me to kind of tell you about them, or?
Yeah, I would love
I don't know, folks. Okay, so I told this one to a reporter the other day, but to me, it was really the first kind of big experience in my psilocybin trip. So all of a sudden, I realized I was in my dad's bedroom just before he died. Now, when I was 14, my dad got lymphoma, and from the time he got the diagnosis, the time he passed away, it was only 3 months. And the last month of his life, he died. He was in his bedroom at home, and we weren't even allowed to go see him. My mom wouldn't let us in the bedroom, so I actually did not see my dad before he died. But all of a sudden, I'm in his bedroom, and I could feel him, and that was the part that just was so not overwhelming, but so powerful for me, is how clearly I could feel my dad's feelings, and I could feel him suffering. And it wasn't the suffering from the cancer; it was the suffering he felt, the regrets. My dad was an alcoholic, and it was he had tough things he had to work through, and I could just feel all the regret he was feeling, as about his life as a father, as a husband, and he was just in this deep anguish. And yet I've done my work. I've come years ago to just come not only to forgive my father, but to really value and esteem him for the wonderful role that he did play in my life. And so I just went to him and I held him, and I remember I called him Papa. I never called my dad Papa, but in this moment I just put him in my arms and I said, "Oh no, Papa, I'm so proud to be your son. Look at the man that I've become. You made me. You're the one who told me about, when Martin Luther King died, you're the one who wept and told me what a great man he was. And you're the one who taught me about human rights." And I just shared this long moment. I'm just bawling my eyes out, having this experience with my father. And then, as so often with people, then the song kind of ended, and then that moment kind of disappeared. And I was just like, what was that? I had never experienced anything like it before, And then I had another moment where my wife and I lost a son a number of years ago, and then she showed up in my trip, and I could feel her feelings, the loss a mother feels, which is very different than a father's. And just again, holding her feelings in what felt like a swirling river that I was kind of floating down, but it wasn't painful. The tears I shed were just beautiful, beautiful tears. I had a number of these like very cosmic moments of seeing the universe. I had one moment where I could see myself in my mom's embryonic sac, and I knew it was me. And I was both watching myself, but I was also myself looking out. And all of a sudden, this beautiful, warm presence came right up and looked at me and said to me, "I love you so much. I have known you your whole life. I have been with you your whole life. I'll tell you, I've read about the love of God, the love of the divine. I'm a person of faith. I have a spirituality. I've thought these things my whole life, but never have I experienced it like that." That was a knowledge that went very, very deep. I had a moment with my own son, who passed away, which again, I don't know what to tell people about that. I just say, it kind of happened. And all of a sudden he just kind of showed up, and it was a different quality than any other moment I had in my experience. It was less kind of dreamlike. This was very like he was sitting right next to me. And I said, "Sean," I said, "I've missed you so much." And I said, but we're doing good. And I said, "I just want you to know the family's doing great." And then I needed to tell him, I said, "I just want to tell you what a wonderful son you were to me." And I remember holding him just while this song was going. And I'm just bawling my eyes out and just telling him how much I loved and how proud I was of his dad. And I was just stroking his head like a father with a son. And then I realized I was stroking my own head. I was so viscerally involved in the moment that it was so real for me. And there's a song near the end by George Harrison here that came on, "Here Comes the Sun." And I just remember just thinking, I just love George Harrison. I love that hippie energy that he is. And, then finally the last song came, which was "What a Wonderful World" by Louis Armstrong. What a great ending to my trip that was. And I took the shades off and looked at my guy, and I said, "Holy man, that was the most powerful, life-changing experience I've ever had." And I did say, "And I'm never doing it again." I mean, it's just so intense. I mean, it's a bad analogy. I'm sure it's what, how a woman must feel after giving birth, like, wow, I'm never doing that again. It was so intense. So I'm not going to compare my trip to having a baby, but it was very intense for me. But I certainly don't think I'll never do it again. I'm sure I will. But it was just, it required courage. It required someone being there to give me courage to, and many times my guide held my hand, gave me water at the right time, was just so perfectly attuned to what I was going through. And so after I had this experience, I had to kind of step back. And the first thing that I was just so clear in my mind is whatever questions I had before about whether or not a therapist or a guide needs to have their own experience, it was completely dispelled. I cannot imagine holding space for someone without having my own experience. It's just the quality of experience is just so different. It's like you can't. It's like one of the pieces of Bill Richards. He says the quality of a psychedelic trip, a psilocybin trip. He says it's almost ineffable. It's hard even to put into words, and yet there's this experiential knowing. And so in the months that followed, I began to notice big shifts happen in my life. And the two that struck out is I was no longer afraid of death, and I had been afraid of death. I'd been thinking about death a lot, and not in a good way. And I remember when I finally realized I needed to deal with this fear of death. I was watching the movie Titanic. We all know that movie. The final scene where there's this scene of Leo and Kate just on this piece of wood, and they're holding each other, and you realize he's going to die, and all of a sudden I realized there's going to come a point in time when I'm going to have to say goodbye to my beautiful life partner, or she's going to have to say goodbye to me, and this was not a good moment. But after my trip, I watched Titanic again, and I came to that scene, and I was a little nervous, like, what's my emotional reaction going to be when I get to this scene? But when I got to it, I just turned. I had a vision of holding my wife's hand as she passed away, and I held her hand, and I just said, "Baby, thank you so much for the ride of a lifetime. I would not have wanted to do it with anyone else." And instead of being afraid of death, I was welcoming it. And here the work I'm doing is with people who are dying, and so to be able to work through my own issues of death has just been unbelievable. And so even as a therapist now, because I still practice normal therapy, my ability to be open and curious about my clients is just unreal. But on point, why we would say this is so important. It's probably a bad analogy, but it's what comes to my mind, which is, you can imagine if you had to have your appendix out, and the surgeon shows up and you say, "Well, have you done the surgery before?" And he says, "No, but I read about it in my residency, and I watched people do it, but I myself have never actually done it." And you say, "Can I have another surgeon, please?" Right? Because I don't, even though you might be the greatest, smartest surgeon in the world, if you've never performed a surgery, I'm not sure I want you to be working with my delicate innards. And it's the same, like it's you've never experienced a psychedelic trip yourself, I would have great, I'm not saying that you can't be a good caregiver or any of those, of course I'm not judgmental like that, but I'm talking about holding therapeutic space for someone. If we have to mitigate risk, we have to make sure that they don't have a bad trip. We have to know when to move in, when to stay out. We know how experientially how to support and when to support. There's just so many variables that experiential knowledge and understanding informs. So as you can tell, I'm pretty passionate about that.
There's so much passion there, and it's what I appreciate in you, Dave. And I think that's a beautiful segue, and thank you for being so vulnerable. But as you mentioned, it is very crucial to have that experiential session. And I just was wondering if you could explain what is experiential training in psilocybin therapy. And of course, it really differentiates TheraPsil's training program. And why you've touched on its importance, but what does an experiential training session look like in psilocybin?
You mean what we are going to do in our cohort?
Exactly.
Yeah. So when the health minister granted these exemptions, we got the attention of the world. Some of the best researchers said, well, you guys are the first ones to hold a class where there's going to be experiential learning. And so when there's an experience at the end, you can imagine that all the concepts we're talking about take kind of a heightened awareness, as people they're not only thinking about how they might hold space, but they're thinking about themselves as well. So we do 10 learning sessions where we work with the basic concepts of understanding psychedelics, but then how to use them therapeutically, how do people craft their intentions, how we can establish a nurturing relationship with them, how to actually hold space, and how to integrate afterwards. And so we do that in 10 sessions. And then by our structure, our form is at the end, while we've been going along, they've been teamed up in dyads. And in those dyads, they begin to practice all the skills that we've been talking about: how to prepare intentions, how to create a safe and nurturing relationship, how to prepare them for the dosing session, how to answer their questions. And then when we come to our experiential retreat, we're going to have 2 what we call medicine days. So these are half the cohort will have the medicine day, like for instance on a Friday, and the other half on a Sunday, and then they switch roles, so they hold space. It's done in a supervised environment where myself and other experienced therapists are able to, be with them, observe them, give them feedback, assist when needed. So it's really a holding environment. And then the in-between days, as a cohort, we can begin to talk about our experiences together, make sense, and really learn how to talk with clients about their own sessions, right? Which is how do you take this ineffable, I can't talk about what just happened to me, and begin putting, left brain structures around it, beginning to put meaning and words and language and constructs around it, so that we can build a narrative of how this is integrating into my own life. And so that is what's setting our training apart from any others in the world right now, is that not only do we have, the real credible training part, but we match it with this experiential piece.
That's beautiful. Thank you, Dave. And I'm sure there's many more questions on that. So I'm just going to pass it over to Spencer about the current training challenges and TheraPsil's advocacy work, so we can leave some time for questions at the end.
Yeah, thank you, Yaz, and thank you, Dave, for the detail that you're telling. It's amazing. So I just want to comment on a couple of the current challenges that we're facing. And I think appropriately want to start off with the fact that there are patient applications that have been waiting for the decision by the minister for over 100 days. And I think this is equally reflected in the healthcare practitioners who have been waiting 120 days. Applications are still being granted by the minister and by Health Canada. We got 2 exemptions last week, I believe, or the week before, and there seems to be a slow and steady stream. The problem is that it seems to be quite arbitrary who gets access and who does not. Why 20 healthcare practitioners back in December, but now that there are many more, both patients and healthcare practitioners seeking exemptions, do they not get access through Section 56? And the unfortunate truth, and what we saw 20 years ago with cannabis and the Section 56s that were being granted by Alan Rock at the time, is that it does not seem to be scalable, having exemptions sent out. And I guess what we're seeing is that as patients are being granted access, primarily some of the most critical or critically ill terminal patients, these seem to be taking priority over healthcare practitioners, and it makes sense. I understand the need to support patients first, and we certainly advocate for this. But there is also an element here of putting the theoretical cart before the horse, ensuring that there are ample healthcare practitioners who are able to provide care to those patients is absolutely critical, and they need to be done at the same time. And I like Dave's analogy regarding the surgery. One that I use quite similarly is if it's not enough to give a patient access to chemotherapy, because just writing an exemption for chemotherapy doesn't allow the patient to purchase it, to buy it from a safe source, and it doesn't allow for the entire therapeutic program that goes on behind the scenes with doctors and oncologists and nurses to take place. And I think it's worth acknowledging, with the team at TheraPsil here, and there are many other organizations across Canada and the world, is we are trying to write those regulations, those those treatment protocols to make sure that, patients aren't just being given an application, an exemption, but that they're fully supported, and really, so much respect to Dave and Yaz and the others in the cohorts who have been doing this training and making sure that patients are fully supported. It's incredibly important. So our challenge today is that there are healthcare practitioners who have been waiting 120 days to support their patients, and a number of their patients have been waiting too. So making sure that their voices are heard, sharing their Instagram posts, and it is quite unfortunate that social media is one of the most effective and only ways to get the minister's attention, but certainly also the other healthcare practitioners in this call and those who will watch this recording. I would say to you that, why healthcare practitioners in Dave's cohort and others, and not you, not other nurses and doctors across Canada. It really is showing that we need to move beyond Section 56 exemptions and honor the people that are being helped with psilocybin and the healthcare practitioners that want to help their patients who are getting exemptions. So that's one of the challenges we're working on, and we could certainly use any support from any community members and members of TheraPsil, or those who are interested in seeing psilocybin more accessible for patients and healthcare practitioners. And over the next couple of weeks, we will certainly be showing you how you can take part in that. We'll be hosting more webinars, and also we'll be putting out far more posts to the minister to seek access for those healthcare practitioners who have sent out their exemptions, and hopefully to many more that would like to. So that's it. Thank you again for everyone who came, and I'll send it back over to you guys for any questions.
Awesome. Thank you so much, Spencer, for sharing the challenges we're experiencing right now. And as Spencer mentioned, we'd love you to join the fight for advocacy. I know we only have a couple minutes left, but Holly's been fielding some questions. So if you want, maybe we can do a couple here.
Unmute. There we go. Hi, everyone. Yeah, we've had a lot of great questions in the chat. A few of them will take more than 1 minute to answer. So perhaps we will work towards answering those on our website or in a future webinar. One question that was coming up a lot is, Dave, what was the dose of mushrooms that you took?
7 grams.
Wow. Thank you for letting us know.
Yeah, and the thought behind that is 5 grams would be a kind of a standard therapeutic dose. Regardless, 5 or 7 is the dose has to be large enough to what we call kind of unhook the default mode network. So that is really a very important mechanism to allow the full brain connectivity that happens during a psychedelic experience.
Awesome. Thanks, Dave. And another question is, do we only support terminally ill or palliative clients? There's somebody particularly interested in working with complex PTSD. Could somebody speak on that, perhaps Spencer?
Yeah, I can absolutely take that. So obviously we want to make sure that we're getting to people on some basis of clinical acuity, reaching those who do not have much time. And so for that reason, many of the people we've been working with are quite close to death and palliative. But we certainly are working on acknowledging the fact that many people that we have supported, and I think the number's 5 as of today, are in remission. So if they have the right and it's helping people in remission with with anxiety and depression, that it certainly should go to help those who may not have a palliative diagnosis. So we're certainly going to be doing quite a bit of fundraising to hopefully expand beyond that, but making sure that we're first and foremost taking care of the patients who are terminally ill and do not have much time as our priority. But absolutely, when our mission is to help those in medical need. And we have had so many people reach out to us with things like cluster headaches, addiction, treatment-resistant depression, some who are using psilocybin and others who would like the support. So as we move into a solution around Section 56, I think it goes without question that we would say, on what basis do we discriminate who gets access to psilocybin and who doesn't? And I really do think that it belongs in the hands of the doctor to decide that. And of course, the therapist and healthcare practitioners.
Sorry, I've been answering questions in the chat at the same time as listening. I am going to be respectful of the time. We said 30 minutes. I'd like to be punctual with that. So thank you everybody for your amazing questions. Like I said, we've been recording them all. I've been recording them all on a separate piece of paper. So we will work towards answering those. You can learn more on our website, TheraPsil.ca/training. And Yas, any final comments?
Yeah, if you have any questions that we weren't able to answer, as Holly mentioned, we'll try and address them on our website. If you'd like to connect, feel free to email me at healthcare@therapsil.ca, and I can try to answer your questions to the best of my ability. Other than that, thank you for joining us and for your time today. And thank you so much, Dave and Spencer and Holly, for this wonderful webinar. Really appreciate it.